Break silence on NASH. NASH 24/7 aspires to bring best-in-class education and awareness program to serve healthcare workers, patients, and their caregivers. Today, on the occasion of World Liver Day, we have a renowned gastroenterologist from Lucknow, Dr. Keshari Yadav. He needs no introduction, however, I would fail my duty if I don't mention that. Dr. Yadav is a leading gastro in Lucknow, providing comprehensive and compassionate care to many patients for various gastrointestinal and liver conditions. He has experience building a clinical skill set that allows him to deliver patient-centric care. He is currently associated with Samyak Gastro and Liver Center as consultant gastroenterologist and hepatologist. So, sir, we salute your dedication to spread awareness related to liver health. So now I invite Dr. Keshri to enlighten us on the topic. Over to you, sir.
Okay, thank you. Thanks for everybody. And so we know that in the past 19th April it was World Liver Day, and the current theme for the Liver Day was the be vigilant, regular health checkup, and prevent the fatty liver diseases. So basically, the increasing trends of the fatty liver and basically the non-fatty liver that causes more difficulty to treat the liver diseases. So we start with liver diseases. So liver is the second largest organ of the human body, and the first being the skin, and it weighs around 1.5 kg. It's the normal content of the 5% of the fat in the liver. It's located on the upper abdomen on the right side, and the color is the normal liver is the brown. It's soft in consistency. It is the high vascular organ. It has the dual supply both by the veins and the arteries. So, what are the functions of the liver? Liver basically have the metabolic functions like detoxify the toxins. It produces the bile that increases the digestion of the fats. It produces the proteins and the cholesterols. It controls near about 500 metabolic processes, and it breaks down when anyone takes the alcohol and the medication, and it produces the nutrients like the proteins and the other nutrients, and it also regulates the blood compositions, and it synthesizes the albumin that controls the blood pressure and such. So for understanding the non-alcoholic fatty liver disease, it may be caused by any one of the any any like the taking alcohol, taking the drugs, or the person who are obese, have the hypertension, have the obesity, diabetes, and the dyslipidemia in the form of the high cholesterol and the PCODs, gallstone disease. So, non-alcoholic fatty liver disease is a term when the person is either not taking any alcohol or taking alcohol in a non-significant amount. That increases the fat in the liver. It is more than 5% and causes the non-alcoholic fatty liver that increases to the non-alcoholic steatohepatitis that leads to the cirrhosis and the further progress to the non-alcoholic end-stage liver disease or the cirrhosis. So prevalence of the NAFLD, non-alcoholic fatty liver disease. So current studies from the India, like the from the Shalimar, from the AIMS, it is about 38 to 52% in the general population, and in the diabetic and the persons who have the other metabolic risk factors like the hypertension, diabetes, or the cholesterol diseases, it increases up to 52 to 60%. So in more than 6 diabetics and the 9 severe obese people out of the 10 have the NAFLD. So male slightly have the more prevalence than the female, and the progression starts from the fatty liver to liver steatosis to liver fibrosis and the cirrhosis. And the healthy liver appears like the smooth, have the smooth margins, and it is have the smooth margin and pink in color, pink to brown in color. When the fat increases, it enlarges. It enlarges, becomes heavy, and further increase of the fat that causes the damage to the liver cells, hepatocytes, that increases the formation of the scars and the formation of the scars and decrease of the normal liver cells, and further leads to strengthening of the liver and the development of liver cirrhosis. That is the cause of the non-alcoholic fatty liver disease. And what are the causes? The obesity is one of the, and the food intake like the trans fat and the more of the oily and the fatty diets that increases the development of the alcoholic fatty liver, metabolic syndrome constitutes hypertension, fasting, hyperglycemia, dyslipidemia, and the central obesity. It is certain medications like the some herbal products and the toxins that increases that also increases the liver fat and causing the fatty liver. So one more important thing, the physical inactivity of the sedentary lifestyle. That persons that do not go for outside for jogging or the exercising, they have the more chance to develop the non-alcoholic fatty liver. So what are the symptoms that the NAFLD or non-alcoholic fatty liver patients develop? So it is a in early there was no symptom. Patient may develop the non-specific type of the symptom like the fatigue and headache and irritability and discomfort or pain in the right upper quadrant when the liver becomes enlarged. And when the person the fatty liver progresses to steatosis or the fibrosis, it may develop with the increase of fatigue and the nausea and the vomiting and distension of the abdomen in the form of accumulation of the fluid in the abdomen, that is ascites, and confusion, development of hepatic encephalopathy, loss of appetite, weight loss, and the pedal edema, and some if in the end stage liver disease, patient will develop the uh, bleed in the form of the hematomesis or the melanoma. So, how we can diagnose? So, fatty liver can be silent killer because of the progression of the disease is very gradual and they do not have any early symptoms. And if they develop, it is a very non-specific type. Diagnosis of the NAFLD often involves a blood test, ultrasound of the fibroscan test, liver biopsy, and the X-ray, CT, or the MRI. So the diagnosis can be divided into the non-invasive and the invasive. So basically, we follow the non-invasive test first, and in non-invasive test, mostly the ultrasound or the fibros is the more specific, and the MRI and MRPDFF are the more specific. But the cost is the major factor, and the fibroscan is available everywhere. So we we can go for the fibroscan. Liver biopsy, when any confusion, any doubt, then we can go for the liver biopsy. So this is a fibroscan machine. It uh, it gives the two values, cap in the form of the orange score and the fibrosis are the KP value in the blue score. So as the KP value increases, it increases the fibrosis, that decreases the elasticity of the liver. Cap value control attenuation parameter, it indicates the degree of steatosis in the liver. It can be graded as the S1, S2, S3. So act when the patient develops the fatty liver, we don't wait. So act before it's too late. Non-alcoholic steatosis hepatitis, it is a more serious form of the NAFLD in which have the scarring of the liver, just injury just started, and the NASH may lead to the cirrhosis or the liver cancer if not treated or not controlled. So how we can go for the treatment? So treatment can be divided into many parts like the lifestyle modification, diet, exercise, and some amount of the medications. And if patient develop the end stage liver disease, we can go for the liver transplant. So control of your weight. So obese persons have the more chance to go for the non-alcoholic fatty liver disease. So weight control is a very important factor. So combination of the hypocaloric diet and the moderate to intensity exercise provided best likelihood of the sustained weight loss. And the weight loss of at least 3 to 5% body weight helps to improve the steatosis component, but 7 to 10% is needed to majority of the cases to decrease the fibrosis. So this diagram shows that if we decreases the weight more than 10%, it it decreases the fibrosis in nearly 50% of the cases. When we are not able to manage more than 10%, if we can manage only 5 to 10%, 5 to 7%, then it is about 40 to 60% of the NASH situation, 60 to 90% of the NASH situation, and the ballooning of inflammation or a decrease. So dietary modification. In the dietary modification, two types of the diets are basically advised. First is the Mediterranean diet, and the second is the intermittent fasting. So Mediterranean diet, we use daily large amount of the vegetables, fruits, whole wheat, grains, olive oil, beans, legumes, seeds, and the herbs and the spices. Weekly, some amount of the eggs, poultry, and the chicken and the yogurt can be added, and we reduce in the diet red meat and the sweets. We can weekly fish and the seafoods are allowed. So types of the exercises, we come to two types of exercises: the aerobic exercises and the resistance exercises. Aerobic exercises is basically reduces the liver fat, so maintains the healthy weight, improves the cardiovascular conditioning. And the resistance exercises, that increases the muscle and increases the insulin sensitivity, improves the metabolic parameter with less energy consumption. Lifestyle tips to tackle the NAFL or the NASH. To develop an exercise routine daily, 5 days per week, and get enough sleeps, get enough vitamins and the minerals, get hydrated, regular medical checkups, eat, eat a small frequent meals which are lower in the trans fats, lower your the sugar content. And so after the lifestyle modifications and the diet, the person is still obese or not, the fatty liver and the status is not improved, some drugs can help. Nasal recommends the following drugs like the bioglucosanes. So it indication is the NASH with or without fibrosis in both diabetic as well as the non-diabetic patients. Suggested minimum duration was 2 years. Some side effects like the renal edema and sometimes in the bladder cancer can be seen. And the saroglitazar, it is the saroglitazar the NASH with or without fibrosis in both the diabetic as well as the non-diabetic patients we can give, and the maximum duration recommended is the 1 year. In the same way, vitamin E NASH with the without fibrosis, but it is not recommended in the diabetic patient, the non-diabetic patient. And then in the non-diabetic patient, we can prescribe the vitamin E 400 milligram twice daily, and the maximum duration recommended is the 2 years. So tips to prevent the fatty liver disease: limits intake of saturated fats and the trans fats, quit smoking, eat a balanced diet, having good amount of the vegetables, exercise regularly, limit consumption of the refined carbohydrates, maintain a healthy weight. If obese, decrease 5 to 10% of the weight, and take the medications as prescribed by your doctor, and limit and avoid the alcohol. Limit or avoid the alcohol. So thank you. Liver does not like the fat. So stay healthy and save your liver. Thank
Thank
you.
you so much, sir, for this wonderful and enlightening talk. Your talk has really enlightened us. So now, with your permission, can we take some questions from the
Yeah,
audience?
yeah.
So, sir, we have a question that what is different between acute and chronic liver disease?
Oh, a very good question. So acute liver, basically the difference is the acute and the chronic is the duration. So in acute liver disease, if the liver is healthy, there is no prior any disease of the liver, like the fatty liver or the others, and the patient developed uh, some symptoms like the anemia, like the jaundice, and the abdominal distension in the form of the ascites or the bleeding or the hepatic encephalopathy, like the alternates. But the the liver should be previously healthy. So it is the acute liver failure. Generally, we consider the acute liver failure within the 28 days. If it is a chronic, more than 6 months, then it is considered as a chronic liver disease.
Thank you so much, sir, for this wonderful insight. And the second question that we have is about fatty liver. That how
Fatty
we
liver.
can prevent fatty liver.
Yeah, so as we talked, fatty liver can be caused by anyone, like the toxins, like the drugs, like the herbal products, like the alcohol, and the obesity and the metabolic syndrome. So for prevention of the fatty liver, there's a many ways. So first, we can modify our lifestyle. We can modify our the diet. We avoid the processed carbohydrates, trans fats, and the saturated fats. We decrease our weight. We do regular exercises, and if it is not controlled, then we can go for the medications with the prescription of our doctors.
Thank you, sir. Thank you so much. And on behalf of NASH 24/7, I thank Dr. Yadav for this lively and informative talk. As you have been emphasizing the awareness for liver health and disease, I think it is equally important for people affected by fatty liver to regularly visit doctors and continue medication.
Yes.
With careful observation and precautions, it is possible to obtain control of the disease. I would also like to thank our audience for their active participation and patience in making this event successful. So stay connected with Nash 24/7 on Facebook and take care of yourself and your family members. Thank you. Thank you so much.